Welcome to all my dears. Today we are going to deal with the management of diabetes. As you know, the cornerstone of diabetic management is patient education. That means we have to teach them or we have to communicate to our patient what actually the diabetes and what about the stage of your diabetes and how it can affect and effect in our body and which are the things we have to change from our daily life, etc. So the patient education regarding the disease is very important, more than the prescription of our medicines. And as you know, if a patient came to know that he is having diabetes, automatically being a very chronic disease, our patient will be under immense stress, immense fear, immense depression, or severe stress, etc. may leads to more complication. So in such condition, we have to empower our patient. We have to give a positive counseling towards our patient, and we have to advise our patient to do some lifestyle intervention along with the disease state education. And along with such a management, we have to screen our patient with their glycated hemoglobin value. We have to evaluate or we have to control their possible hypertension. We have to control the lipidemic abnormality, if any lipidemic abnormality, etc. has to be also keep in mind to management with a diabetic patient, because we have to have an attention of risk factors like various levels of macroangiopathy in patient with diabetes, as they may prone to have a possible stroke or a myocardial infarction or a renal failure or a deep vein thrombosis, etc. has to be keep in mind. And because of that, we have to follow the evaluation of a regular screening of blood pressure, possible lipid abnormalities, and glycated hemoglobins. Some of our patients may having a condition known as postural hypotension. In such condition, we have to support our patient to use the supportive stockings to prevent the venous pooling in the lower extremities. There is a great possibility of venous pooling in diabetic patient. That is why some of our patients with diabetes may having diabetic ulcer. So in such condition, to prevent such a occurrence, we have to advise our patient, if they had the postural hypertension, advise them to use the supportive stockings. And as the pathology advances in diabetic patient, one of the most common PC may be constipation. It is usually due to gastroparesis. That means decreased motility may be presented by our patient as constipation. In such condition, advise our patient to have the low fatty food, decrease meal size, and increase exercise. Along with that, advise them to have a regular food habit, a regular bowel habits, and a regular sleep habit. In such condition, patient can improve their gastric problems. In patient with a diabetic nephropathy, the presentation of diabetic nephropathy primarily may be as a condition of hypertension. In such condition, try to keep our patient's blood pressure less than 130/80 or a maximum of less than 140/90, because then only we can protect the capillaries of our renal system, then capillaries of our cardiac system or our brain. So if we can't control the blood pressure, the same may leads to leakage of the capillaries and thereby damage of the vital organ may result as either as CKD or as angina pectoris or myocardial infarction or as stroke. So keep in mind, along with the management of diabetes, keep the blood pressure less than 140/90. Otherwise, that may damage the vital organs. Next, about in diabetic patient regarding their food, advise them to have a control over the protein intake. Usually in diabetic patient, that may leads to weakness of the renal system, weakness of the protein metabolism. In such condition, blood urea may be comparatively high with a diabetic. If so, then advise to have a low protein diet. At the same time, in patient with a severe proteinuria, and that may also leads to a condition of hyperproteinemia. The hyperproteinemia may be presented as a great weakness or edema or a frothy urine or a pulmonary issues. In such condition, evaluate the serum protein levels, especially with the comparing the serum albumin and globulin. As you know, the serum protein level is varying from 6.5 to 8.5, and albumin of 1.5 to 3.5, and globulin with 1.5 to 3.5, and albumin with 3.5 to 5.5. In such condition, the albumin globulin ratio will be 2:1, and if it is lesser than 2:1, we can advise them to have the protein food. So the restriction or adding of protein depends on the protein levels and the urea level of our patient. Keep in mind. And next, about the abnormal lipid levels. As you know, most of our diabetic patient may having, along with the diabetes, with some abnormality in the hepatic issues also. Due to the hepatic dysfunction, it may presented as abnormal lipid profiles. In such patient, usually the LDL or the TGL may be very high with the diabetic one. You know that the elevated level of LDL and TGL are very high risk with the cardiac, central nervous system, or with the renal complications. In such condition, LDL level should be kept less than 100 milligram percentage, especially in patient with a history of any cardiac anomalies. So along with treating diabetes, try to protect the other vitals also. And more than the all management criteria, early detection plays great important role in the management, because as the pathology advances, the control or the reversibility of the diseases become lesser and lesser. And in patient with type 2 diabetes, surgical intervention also gives some positive results in diabetic patients, especially in patient with diabetes along with BMI more than 35. Laparoscopic surgery by duodenojejunal bypass and laparoscopic diverted ileal interposition plays great important positive benefit in patient with type 2 diabetes. And other than the surgical management, if we manage the diabetes in a better way, we can control and we can postpone the complication of vitals, because by improving diabetic control, we can reduce the hospital mortality up to 34%. And by controlling the diabetes, we can reduce the possibility of sepsis less than 46%. By controlling the diabetes, we can reduce the hemodialysis, especially in CKD patients, and we can reduce the transfusion of blood near about 50%, and we can minimize the possibility of polyneuropathy about 45%. So, to protect the patient's quality life, to protect the possibility of various levels of sepsis, to protect the vital organs like renal system, our heart, the main viscera, our brain, the management of diabetes plays high value. And next we have to study about, I think, the complication of diabetes, investigation of diabetes, and the proper treatment of diabetes. I think that can be studied in next class. Thank you. Thank you for watching. Okay. Stay safe.